Hmm. So, there are a lot of people who are into ozonated water. So, do you think that would be a really good way to get ozone in the body?
It's better than nothing.
Okay.
I was shocked several years ago. This was about 5 years after my venture to Sierra Leone. I went back to Africa. I had an African man come to me from Guinea for prostate injections for his prostate. And he told me about his wife, who was a Polish nurse living with him in Africa.
Hmm.
Now he got better. His prostate went from 6 urinations a night to two in just 2 weeks by injecting his prostate with ozone.
So
He
this
told
is
me,
just prostate enlargement. Is it BPH? Okay.
yes,
Wow. Because that's a challenging condition that the traditional medical system really doesn't have a whole lot to offer.
doesn't have a lot. We teach this in our workshops. We have seminars, and we teach doctors how to do this. And by and large, it works. Nothing's 100%. We've had some failures, but nighttime urination in men gets better
Mm.
by and large. So he got about 70% better in 2 weeks, doing them twice a week. I then went to Guinea to visit his wife, and she was treating people with ozone water, ear ozone, and rectal ozone. That's what she was doing and seeing phenomenal. I mean, I had to go to see this, and I did.
Hmm.
It's a dirt poor country, really, really poor, intermittent electricity. And when the electricity was running, she'd make ozone. She'd
Hmm.
ozonate water, put it in the freezer, let a cap of ice get on top to hold it in, and refrigerate it for the rest of the day, and it would stay good. And she gave her patients ear ozone, rectal ozone. I taught her how to do her husband's prostate, and she did that. And so ozone in any form is going to work. Some forms I believe are better than others. Sylvia Menendez in Cuba mostly relied on rectal ozone,
Mm.
putting ozone gas in the rectum. Women have an advantage. Women can take it vaginally as well.
Hmm.
It works, especially for local female conditions.
Hmm.
You probably can get a lot more ozone in the rectum, though, than in the vagina.
Mm.
And Howard Robbins, he did DIV, direct intravenous gas, where you inject a bolus of ozone gas, and that's what I taught her how to do as well, into the vein. It's
This is
dirt.
still a little controversial among the medical professionals. Some say definitely don't do it. What's your opinion on this?
I tend not to do a lot of it because of vein issues. Ozone can scar veins and make them disappear,
Mm.
just like intravenous hydrogen peroxide, just like high doses of vitamin C, ascorbic acid. That will also scar veins and make them go away by the same mechanism. In the case of gas, ozone gas, it's not air you're putting in, it's oxygen.
Hmm.
Oxygen is rapidly metabolized and taken up by the blood. Giving gas can cause a little bit of chest tightness and a cough. And some people are really concerned about that. Um, I've had DIV ozone, and yes, it's caused a little bit of chest tightness and a cough that lasts 10 or 15 minutes sometimes. I don't think that is worth the fear. But there's a big political brouhaha about this, where some ozone societies are saying, no, you can't do this. It's wildly dangerous, and they blackball you. In fact, we quit one ozone society because it demanded that its members sign a pledge not to do it. And I'm not going to sign a pledge not to act in the best interest of my patient.
Mm.
If I think that DIV is in the best interest of my patient,